Hey, this is Jason Tuschman. Welcome back to Doc Biz. Fortunate enough today to have a good friend of mine over the last year and a business partner, Dr. Edward Dickerson from Fayetteville Plastic Surgery. Doc, thanks for coming on.
Hey, thanks for having me, Jason.
I appreciate you spending some time with us on Friday. Excited to get some of your knowledge out here to your peers. Before we get started, if you could just give us a quick background on your medical experience academically and professionally, would love to share that with the audience.
Thanks a lot, Jason. So I'm actually a homegrown Army military guy, trained as an otolaryngologist, board certified ENT at a Brooke Army Medical Center, facial plastics board certified, and also a member of the American Academy of Cosmetic Surgery. After that, I did most of my stuff in operational medicine at the biggest and the busiest military hospital in the Army, and that's actually here at Fort Bragg, where we have 82nd Airborne and Special Forces guys, and so that actually background has really helped me, especially during these times. I tell a lot of my guys, hey, this is an opportunity. It's a small inconvenience and an opportunity to excel. And so being able to pivot on a dime is something that a lot of, my military peers and counterparts are, really, reaching back into our bag of tricks to make things happen for our practice.
So if I could pause you there, I would love, as a doctor who's been in the military, working in a high stress environment, how have you taken those learnings from that environment and put it into today's environment with COVID-19 in the last couple of weeks? How has that impacted your decision making, your leadership style with your team, and what are some of the things that you think directly you brought to the table over the last couple of weeks from your time at Fort Bragg?
So I think it actually has made our leaders, especially our entrepreneur leaders, first of all, nobody's going to save us. Nobody is going to, make this happen. Just like when we started our practices, this is a eat what you kill environment.
Yeah.
So you got to go out there and kill something. And so how are we doing that? Believe it or not, all of my staff is actually understands the validity of what's going on, the intensity, and all of a sudden hey, things are real, things are now kind of deal. And so all the things that I wanted to consider or being able to institute, it's actually much easier because now we have something that we usually do not get in, this fast-paced time. We have time. We have time to work on our practices versus just working in them. And now we have actually a captive audience because our staff knows that they need to do everything that they need to do to basically keep the practice going, to keep the lights on, to help you basically, keep their jobs and to truly work together as a team, because now, just like in the military, we actually have a common enemy.
Yeah. It's a little bit of a motivator from that standpoint.
Exactly. It's a great motivator. And so
Yeah.
not only do I have to guarantee everybody's salaries and workload, there is now more of an idea to how to participate. And so many of us out there, hopefully they're saying, hey, doc, this is what I can do. This is what I can do differently. This is what I can do if I'm working at home. And I think that you really get the opportunity to see some of your best followers become leaders because they're going to take that initiative. It's basically upon us to be ready to see who is rising to the top, if you will, and reward them with more responsibilities and things of that nature. I think that your practice becomes very efficient that way.
Yeah, it's interesting, you think about the surgical pressures you must have been under at Fort Bragg. That experience as a surgeon is giving you the business skills to run your practice under a stressful environment versus the surgery under a stressful environment. It's kind of interesting how those correlate.
No question. At a very early age, you become the chief of your departments or chief of the surgery. And not only are you responsible for, a huge hospital, but all these resources. And not only includes the resources, but you're also dealing with the soldiers and their families, just like with your community that you serve, or even the patients that you serve that are in your database.
Yeah.
So I can tell you that this is an opportunity to really sharpen your skill as a leader, to kind of figure out what a leader that you are, and more importantly, get the help, whether it's these podcasts or everything out there. I probably listened to more podcasts and webinars in my past 2 weeks because now you're looking for that pearl, just like when we're going to a medical meeting, we're looking for one of those 2 or 3 pearls, and not just to do a procedure or to diagnose or do a treatment. We're now trying to treat and diagnose our practice, if you will.
Yeah, 100%. I've been listening to podcasts every morning. There's the educational part of it, which gives you security and that boost of confidence to get your day started and how to attack your business. And then, there's the pearls, as you say. So speaking of pearls, you moved very quickly in the last 2 weeks, setting up your virtual consultation process and had amazing success. In the last week, and I may be off on the numbers a bit, you had 3 days of surgery coming up this week that you had to cancel because of the restrictions in your area with COVID-19. You filled up all 3 of those days with virtual consultations. We talked on Friday evening. You told me about that. My mind was blown. Can you explain to your peers what you've done in your business and practice, how you implemented the technology, the communication, and more importantly, how you shifted so quick with your team to get to fill up 3 days worth of surgery with virtual consults? It's an amazing accomplishment.
Well, thanks. And I don't think it's a rocket ship. I think that you see, like on my little, this is our motto that we have, that, we've been running around, for the past several
Be
months.
intentional.
That we adopted for you have to be intentional.
Yep.
And, in the military, there's a phrase that we use: you got to shoot, move, and communicate. So the first thing is you have to do something. You have to do something. And so we actually, said, hey, we need to, pivot. These revenues are not coming in. We've got hours on the books. So how are we gonna shoot? How are we gonna go on offense, if you will? And this was just as simply of checking on people. Hey, you're calling them up. And first it was just a phone call. Hey, we want to just let you know what's kind of going on. We know that we don't know what's happening here, but is there anything else we can talk about while you got it on the phone? I know you want to talk about this. What we're finding out, the people who are getting one surgery or considering one surgery are now considering that second surgery, because now that they will have time once the doors open up, which has been really, really exciting. So I, of course, had to become intentional as a leader, and I had to have an intentional plan, and we had to get everybody else on board with being intentional so that we can essentially survive this. So I think those were the key things: is be intentional and shoot, move, and communicate. So after we went on offense, we moved into place, kind of figured out we had iPads that were sitting around in the rooms, and we used them for before and after pictures and patient education. We quickly put everything on Zoom and FaceTime, and then we communicated with our staff and then communicated with the patients. We just wanted to let them know, hey, we're here for you now.
Yep.
Not tomorrow, not next week. We're here for you now. And by the way, get in touch with your doctor. I mean, one of my favorite things that we do, hang on one second, I got to show you this. Just stay right there, guys.
Yep.
So one of the things that we actually said that we were going to do is we were going to make house calls. I brought out, my old doctor.
That's great.
And we're making house calls.
That's
we're
great.
coming to you guys and let you know that, hey, we are available. We're here for you now.
Yeah.
This is what we want to let them know. And to be honest with you, it has been an overwhelming response for the patients to say, hey, thank you for being convenient. And you know what? This is how we've changed medicine. We're not going back to the old way. I'm sorry.
Yeah, 100%. So along that, you've done some pretty interesting things. It's a tough time business-wise for everyone. Deposits and things like that are a little bit harder to get. Completely understand that. You've done some things with adding in services and things like that to help kind of the closing process and the patient acquisition process during this time. Could you talk about that?
So when we sat around, and my staff actually came up with this, to be able to, quote, sell a future, if you will, is really tough. And I think that, I was never a person that would like to discount things, but to always add value. So in a perfect world, you're getting the patient to pay for their whole surgery. Secondary, they're at least putting down a deposit. And then third, you're at least providing the information that they need to follow up in the near future. But for the person who's, let's say, who already has a connection with you, I think you need to, if you can, to be able to reward, that great relationship behavior. So it may be to add value. So if you're doing an eyelid surgery, maybe you should consider adding value of a chemical peel. Or if they are essentially were interested in laser hair removal, providing them with a free treatment. You can even consider doing some cross marketing. So if they're already a injectable patient of yours, consider doing so many units or an area of wrinkle relaxer or filler for them. I think that once again just lets them know that that you trust them, and whether that's the full or even some of the deposit. And every practice has to figure that out. But I think
Yep.
that's how you are just telling your patient you're not just more than a checkout, if you will,
Yeah.
but hey, we want to provide wellness for you. And what can you provide even for them now? I think these folks are just sitting at home waiting for us to tell them what to do. And
Yep.
so use some of the things that you already have. Try not to spend any more money, physicians, if you don't have to. How do you basically repurpose or recycle what you already have, whether that's content of old videos, things of that nature?
So, to close up, one of the things have really enjoyed about what I've learned from you, and really practical business tactic that I see you do better than anybody out there. You have a great way of studying your marketplace, studying your competition, and putting that into an executable plan and measuring it. Could you talk a little bit about the things that just appear to come natural to you in surveying your competition, surveying your market, and how you transfer that research into actionable items? I'd really like to close with that. I think it's a great value that you create for your business that people should be considering.
Well, I don't think of it as new or innovative. If you were a football person, you'd scout the other team. If you're military, you'd send out your scouts to figure out what's actually out there. And so I usually take, the approach of, hey, we don't have any money to spend. What can we do to research? I mean, we have this great tool called the internet, but now it's a matter of, yeah, well, I didn't have it when I was in medical school. So
Yep.
now it's a matter of start from, hey, in a perfect world, in this case, if I wanted to increase my exposure of virtual consultations, how do I get it out there? I do think working with your initial database is great, sharing it and asking them to share it with their friends. But if you're going to basically invest money, it's trying to just the people that you're working with now, ask them the question, hey, if I had $100, where would I put this money to actually consider more virtual consultations or a particular service or a particular product or something that gives us passive revenue that we can do that you're not home, whatever that is. Whether it's, hey, if you've got a weight loss center, well, that's something that they can do at home that they don't necessarily have to come in to see you for.
Yep.
How do we purpose, what we already have, or if we're investing, pay per click or any kind of advertising, you really want to have a strategic plan, be intentional about how you're spending your money, and then get everybody on the same page.
Yeah.
One of the things I can tell you that I would recommend, it's a very short one, is actually go read a small book or that'll read to you called the Rockefeller Habits. You come up with one-page strategic plan. Your staff actually will do it for you because they want to participate. They do want to help you. And if you allow them to participate, they're going to give you the ideas and the passion that they will follow up for you.
Yeah, absolutely. Dr. Dickerson, thank you. It's been a pleasure as always. Really, really appreciate you sharing some of your business knowledge out there. It's a tough environment. We think that there's a lot that can be offered through this, through DocBiz and through meeting with people like you, and I really, really appreciate your time.
Hey, thanks for having us, Jason, and we hope to speak to you soon. And docs, keep sharing your tips out there with each other. We're in this together.
All right, bud, take care.